Hello everyone, so today we're going to explain about vaccine management system, to be specific, blockchain system. This is our group members, and 5 of us will be with you throughout this video. Video content, introduction, role and application of vaccine management system, advantages and disadvantages of vaccine management system, futuristic vaccine management system innovation, technology applied in Malaysia and overseas, impact of vaccine management system technology in healthcare, and lastly, its conclusion.
Introduction. Vaccination, which everyone has been talking about since WHO declared the COVID-19 pandemic, has now started on a global scale. Each country conducts a vaccination program that takes care of the social and economic interests of its people. Until the injection, the supply chain management, security, and transparency of this program is a process that needs to be analyzed well.
Role and application of VMS. What is VMS? VMS is the Vaccine Management System, and it is one of the pilot projects in the National Blockchain Roadmap. VMS was developed by MIMOS, Malaysia's National Applied Research and Development Center under the Minister of Science, Technology and Innovation, and this system is based on Hyperledger Fabric blockchain. It ensures the good governance of COVID-19 management to support the COVID-19 National Immunization Program. It is designed to prevent counterfeit vaccines and to generate digital vaccination certificates. The system provides the visibility of COVID-19 vaccine in the whole supply chain. This initiative also provides the traceability and security of the vaccine to it and its recipients while keeping and generating vaccination information for cross-border and traveling purposes. The system also can be expanded to other types of drugs and vaccines in the future. To understand more on how the system can manage to achieve this, we need to learn what a blockchain is and how it works. A simple analogy for understanding blockchain technology is a Google Doc. When we create a document and share it with a group of people, the document is distributed instead of copied or transferred. This creates a decentralized distribution chain that gives everyone access to the document at the same time. No one is locked out awaiting changes from another party, while all modifications to the doc are being recorded in real time, making changes completely transparent. Of course, blockchain is more complicated than a Google Doc, but the analogy is applicable because it illustrates some critical ideas of the technology, which includes it is a database that stores encrypted blocks of data, then chains them together to form a chronological single source of truth for the data. Digital records are distributed, creating an immutable records of an asset. Records is decentralized, allowing full real-time access and transparency, and a transparent ledger of changes preserve integrity of the document. The role of VMS are to allow the tracking of vaccine movements throughout the supply chain process, to provide traceability based on the serialized number to identify vaccine receivers, to provide vaccination status to authority as a digital health certificate when required, to prevent counterfeit vaccines, to provide vaccination status check for subsequent vaccine doses, and to allow patients to provide feedback through MySejahtera on any symptoms experienced. What are the advantages and disadvantages of this technology? The advantages include: Number 1, it minimizes manual effort. All the vaccine-related workflow can be automated easily on the management system, reducing the human effort. Number 2, it efficiently tracks each vial of vaccine until administered to the patient. The system helps in product serialization and hence protects against any thefts while also allowing to capture the product life cycle. Number 3, inventory management becomes easy. Vaccine inventory management helps in demand forecasting and hence enables the medical facilities to order more vaccines in the right quantity at the right time. On the other hand, the disadvantages include it requires investment to ensure adequate connectivity levels and to support large numbers of simultaneously connected users. Systems complexity is also greater, which means they can be more expensive and difficult to develop. Additional infrastructure and a dedicated team are also required to respond to system failures. Lastly, clear guidelines on how to record vaccination if the system is down are needed.
Hi, my name is Wan Anwar. So next I will continue to discuss about the technology applied in Malaysia and also overseas. Right. So like Malaysia, the digital COVID-19 vaccinations certificates in Singapore are also secured by the blockchain technology. Moreover, both countries collaborate to ensure they have interoperability between these two systems. So in order to facilitate the cross-border movements, both countries are currently working on a mutual recognition of the certification as well as the testing, relying on each other's certifications. So basically, Zuellig Pharma is one of the Singapore's pharmaceutical companies which employ the blockchain-based vaccine management system that came with the traceability features that tells the exact batch of the vaccine for inoculation. On the other hand, India deploys a single data system which includes a digital application called the Electronic Vaccine Intelligence Network, or EVIN. It is a digital mobile and also a web-based systems that enables real-time visibility of the vaccine supply chain and also the cold chain logistics. For a quick and efficient decision-making and actions, it offers end-to-end tracking of the vaccination inventory, automated data analytics, and also the instant alerts. Okay, later on, the Indonesian version of the EVIN system was rebranded as SMILE, which called the system Monitoring Imunisasi Logistik secara elektronik. SMILE is a mobile and also a web-based application for immunization and logistics monitoring system. This application offers a comprehensive system from the registration stage, distribution, to the implementation and also the monitoring of the first and second batch of the vaccinations. For immunization and logistics monitoring system, this application offers a comprehensive system from the registration stage, distribution, to the implementation and also the monitoring of the first and second batch of the vaccinations. SMILE consists of mobile app for cold chain handlers, a web interface for data storage, and a temperature logger which monitor storage temperature of the vaccines to ensure that the quality vaccines are delivered as required in a timely manner. It enables real-time visibility of vaccine cold chain logistics by digitizing the stock supplies and storage temperature across the vaccine cold chain points. Alright, next, another efficient vaccine management system is the CDC's Vaccine Identification Pilot, which is the standardized GS1 data matrix barcode technology. So it is being used in tracking and identifying all the vaccines in the United States. It can track from raw materials and ingredient suppliers used in the manufacturing vaccines all the way to the end user. So basically, these barcodes on vaccine vials and syringe can be scanned into patients' electronic medical records and then used to populate downstream systems. So this will help vaccine providers to enhance patient safety with more accurate and also have the complete vaccine data. So we reflect back in Malaysia, regulators and licensed vaccine importers should consider a traceability method such as those mentioned above. So the ideal vaccine management system will be one that can provide a real-time end-to-end supply, chain tracking and also a monitoring of vaccines by combining the AI, artificial intelligence, and the blockchain with the Internet of Things and also robotics that will ensure the entire supply chain is automated and preventing it from being meddled with other people. So we reflect back in Malaysia, regulators and licensed vaccine importers should consider a traceability method such as those mentioned above. So the ideal vaccine management system will be one that can provide a real-time end-to-end supply, chain tracking and also a monitoring of vaccines by combining the AI, artificial intelligence, and the blockchain with the Internet of Things and also robotics that will ensure the entire supply chain is automated and preventing it from being meddled with other people.
Fifth part, futuristic VMS innovation. In the system design, VMS consists of two components which are vaccine logistic tracking (VLT) and post-vaccination and proof of vaccination (POV). First phase, vaccine logistic tracking or VLT. The system is the software that enables pharmacists, medical officers, and authorities to track the vaccine supply chain from the importer or manufacturers, distributors or wholesalers, healthcare facilities, until its recipient of consumers and patients using the blockchain technology. It covers the what, or the vaccine identifier, when the date and time, where the destination or location of events, who the person in charge, and how activities are involved. Using blockchain, VMS will consolidate all the information gathered by multiple parties where importer or manufacturer begin their serialization, aggregation, and commencing list of vaccine identifiers and quantities, the shipment or logistic movement, storage and warehouse information and its destination. Next, the distributor will scan package, retrieve hierarchy, and send updated hierarchy upon shipment. As the healthcare facilities receive package, they will scan the package, retrieve hierarchy, update inventory, authenticate date and time of dispensing, and send consumption notifications. At the end of the chain, consumers are using the blockchain system to authenticate the vaccine via smartphone or SMS. In the second phase, post-vaccination and proof of vaccination. How it works? When individuals receive a vaccine at PPV, they will scan GS1 or vaccine code using MySejahtera application. Then, data is transmitted to VMS server through MySejahtera applications. The data contain information consisting of name, identification card number, PPV location, and medical officer MO name. Thus, when local authority needs to verify the person vaccine certificates, they only need to scan QR code at MySejahtera using verifier applications. System design allows data to be verified from VMS server. Therefore, authority will retrieve digital health certificate based on authorization code contained in the QR code. What are the differences in first and second phase? In first phase, VRT is used by Bahagian Program Perkhidmatan Farmasi (PPF) and integrated with Pharmacy Information System (PHIS) and Clinic Pharmacy Information System (CPIS). The use is to ensure only genuine vaccines are distributed and it is in top quality. Meanwhile, POV is executed through MySejahtera to ensure high assurance vaccination are recorded for the right persons with the right vaccine.
Okay, now let's move to the impact of VMS technology in healthcare. The first one is reduce costs in supply chain. Blockchain allows the real-time tracking of a product within the supply chain without the involvement of the intermediaries. Thus, the cost of moving items can be reduced. The second one is improved transparency. In order to have data transparency in technology, entities must have a trusting connection. The medical data and healthcare record in question should be safe and secure. In the vaccine management system, which is blockchain system, the data are safe and spread across the network, which make it more transparent and safer against the third-party interference. It is not owned by anyone, but rather provides a standardized protocol that all participants along the supply chain can join and share relevant data. The third impact is immutability. Existing data cannot be deleted, only appended, which drives a high level of accountability by the participant that will write the new data. For instance, blockchain's greatest advantage is to have the immutability of storage condition data. This is to ensure the vaccine storage temperature is recorded on the immutable databases and also the vaccine safe and effective. And lastly, to improve security and privacy. Blockchain system use asymmetric cryptography to secure the transaction between the users. In this system, the user has a public key and also a private key. This is a random string of number which cryptographically related. It is mathematically impossible for a user to guess another user's private key based on their public key. COVID-19 vaccine management system is a secure cloud-based which enables the vaccine management and also data sharing across the recipients, hospital, healthcare provider, local, state and federal government, and so on.
As for conclusion, Vaccine Management System is an innovative tracking system for COVID-19 vaccines. It is to ensure credible information to support the issuance of COVID-19 immunization digital certificate. The system is a software solution that enables the pharmacists, medical, and respective officers to track and trace the vaccine supply chain from manufacturers until its recipient using the blockchain technology. Vaccine Management System is a futuristic technology innovation as the system is integrated with Pharmacy Information System, Clinic Pharmacy Information System platform, and also MySejahtera in order to track vaccine movements starting from stock acquisition point until vaccine distribution to public. Vaccine Management System has several advantages. First, manual effort can be minimized as the system could be accessed easily from any corner of the medical facility by multiple authorized personnel. Second, each vial of vaccine can be efficiently tracked until administered to patient. Third, the inventory management is become more efficient and helps in demand forecasting. However, some improvement can be made with vaccine management system as it requires investment to ensure adequate connectivity levels. Clear guidelines must be established on how to record the vaccination in proper manner to encounter problems in a situation if the system is down. Innovative technologies such as vaccine management system have several impacts in healthcare, such as costs in the supply chain can be reduced as involvement of intermediaries is eliminated. Other than that, transparency can be improved as vaccine management system using system blockchain, thus the data are saved and spread across the network. The system is also immutable where existing information cannot be deleted and can only be appended. Last but not least, by using vaccine management system, the security and privacy of technology in healthcare can be improved. That's all from us. Thank you.